Good afternoon, everybody, and welcome to today's presentation. This is the fourth in our 2016-2017 Colorado Public Health webinar series. Really excited to have such a large group joining us today for another wonderful webinar. This is Brian Turner. I'm the current president for the Colorado Public Health Association. And for those of you who aren't familiar with the association, we're the largest public health association in Colorado, and together with a really diverse coalition of partners, we help to provide a collective voice on behalf of Colorado to educate, empower, and really develop Colorado's public health community. So if you're not familiar with the association, please check us out. This webinar is just one of the ways that CPHA and our partners are following through on our commitment to advancing health equity and our goal to really give all Coloradans an equal opportunity for healthy and meaningful lives. A couple of housekeeping things before we get started with our presentation today. CPHA members can access all of our webinars at our website, which is coloradopublichealth.org. And what we post there along with the archived webinars is also some really helpful additional resources and information on the wide kind of range of topics that these different webinars cover. They all have a health equity focus, but it's everything from built environment to policy and advocacy. Our first one was health outcomes for transgender youth, and we've got plenty more coming down the pike that are going to be really valuable. So that website is where you can access those recorded webinars, and it's also a great place to just learn about all the other things that CPHA is doing on behalf of public health as far as education, policy and advocacy, professional development, and a lot of really fun networking opportunities for the public health community. So check out that website, coloradopublichealth.org. Once again, we have a very large audience for today's webinar, so all of the Q&A is going to be done by folks typing in your questions on the taskbar kind of that comes up when you logged into the webinar. There's a tab for questions, a tab for chat. You can use either of those, but go ahead and type in any questions that you have for Adam as he goes through his presentation, and we'll do some facilitated Q&A at the end of the PowerPoint. So with that, we'll go ahead and jump in. Our presentation today is Adam Anderson. He's a population health epidemiologist, Tri-County Health Department, and he's going to be giving a presentation that builds on last month's theme of public health in the built environment. And Adam is also one of our wonderful CPHA board members, so want to recognize and acknowledge that. Really appreciate having him here, and with that, I'll go ahead and turn it over. Thanks.
So is the screen all set up then on your end?
Go ahead.
Okay, so as Brian mentioned, my name is Adam Anderson. I'm a population health epidemiologist at Tri-County Health Department and a CPHA board member. And I want to thank everyone again for taking the time to join us for our monthly webinar series. All of us at CPHA have been, been working to define what our member benefits are, and part of that includes continuing education, which our webinar series are a part of, in addition to our Culture of Data conference, which we'll be hosting later this spring, and of course, Public Health in the Rockies. So hopefully these webinars are informative to you all, and please let any of us know at CPHA if you have any ideas for upcoming topics or presenters that you'd like to hear. So again, I'm a population health epidemiologist here at Tri-County, where I spend most of my time collecting and analyzing data to begin to describe cultures, communities, and demographics and their relationship to health outcomes and behaviors. Before this, I worked at CDPHE as a GIS analyst, and prior to public health, I worked for about 10 years as a land use planner for a private architecture firm in Denver. As a planner, I worked across Colorado, but mostly in the Front Range on both suburban and urban residential developments, parks and open space, and comprehensive master planning. And the idea that we have a relationship with the land and that the communities we build for ourselves can influence us and our society has always been something I've strived to better understand. Most of you who know me as a data and mapping guy, so Most of my past presentations have just shown a lot of data and maps and interpretations of data that help to lead a story. I'm actually really excited about this presentation because it's slightly different in both style and topic, in that it's a broad overview of a accumulation of thoughts that I've had over the last several years based on my observation of how we've been building out our communities, both in Colorado and across the country, and their impact on culture, communities, and social determinants of health. So this is what we're going to cover. We're quickly going to look at the state of public health and built environment topics. We'll review the socio-ecologic model specific to the built environment. We'll have a broad overview of the built environment's relationship to social determinants of health by looking at what does the built environment provide for us as individuals and as a community, an overview of how we currently build out our communities, and then assess the relationship between social determinants of health and the cities we've built for ourselves. We'll end with what is public health's role by giving a really brief overview of the planning process and current examples of where public health can have a voice within that process. Then we should have time to take comments and answer a few questions. So what I want everyone to walk away with knowing is, number one, how the built environment influences us and what it provides us as individuals and as a society. Number two, understand the relationship between the built environment and its effects on social determinants of health. And number three, provide another narrative where public health can make a difference in addressing social determinants of health through the built environment. Finally, there are a few assumptions I'll be making during the presentation, and hopefully most people will agree with these. The first one being, if we improve social determinants of health for a group of people, we will improve their health. That being poor is bad for your physical and mental health, and that low educational attainment means you're more likely to be poor. First, I want to describe a quick example to set the stage. We all know that living in a high poverty, low education, and high crime neighborhood will shape our culture, our communities, how we interact with society, and who we are as individuals. It will influence our goals and the expectations that people in society have of us. What we see becomes our reality of what life is for us and for our future. And for people living in these conditions, without any exposure to anything else, it is difficult to aspire and achieve anything different. Poverty and working low-wage jobs and barely getting by makes it difficult, if not impossible, to prioritize education, eating healthy, physical activity, or any of the other things we often try to promote to reduce chronic disease. And for the rest of society viewing this community, our expectations of this community are skewed. For a lot of us, we probably would not just assume that a high school kid living here is going to go to college. And I think we would all agree that the inverse could be true for extremely wealthy areas. Having everyone around you with the outward appearance of success and achievement can consciously and subconsciously set the expectations for education and success for both adults and children. The availability of resources and leisure time allow for prioritizing education, eating healthy, and physical activity. And again, for people who live here, what they experience becomes the reality of what life is for them and their future. And without any exposure to anything else, they are likely to live up to the expectations that people in society have for themselves or for them. For the rest of society, when we think about what our expectations for a community like this would be, I'd say we probably all automatically assume that any high school student here would be going to college. So if we all agree with the premise that on the extreme ends, that community characteristics can impact who we are, the expectations of ourselves and of our children, and the structure of the community as a whole, then the same should apply for the rest of us. Most of us live somewhere in between those extremes, and it's important to understand the factors in the environment that can impact issues around poverty, achievement, social interaction, our community, and us as individuals. This is not to say that everything we will discuss can be generalized to all communities. Every person, culture, and community has a unique experience that shaped their reality. Social science is far from exact, so I can't emphasize enough that the purpose of this presentation is to generate discussion around what are the characteristics of our communities that can have an influence on social determinants of health, and what are additional ways we can look at the built environment to improve health. Right now, the majority of tactics public health and urban planning use are focused on infrastructure, which makes sense. We need sidewalks, parks, healthy food, awareness of nutrition, clean air, safe homes, bike lanes, active transportation. We can't eat better, get more exercise, and attempt to improve our health without the infrastructure in place. And when we look at CDPHE's health equity model, the physical environment is right there under determinants of health. And generally what has occurred is that these types of infrastructure resources are often least available to those living in poor communities. And so in an attempt to address social determinants of health, there's been a focus to provide these types of resources in underserved communities. However, I will argue that merely putting these resources in underserved communities does not actually address social determinants of health, and in some cases may exacerbate inequities by fueling gentrification of certain neighborhoods. I'm sure everyone has seen some form of a socio-ecologic model. When we align built environment strategies to this framework, those infrastructure pieces are related more towards the intrapersonal and individual levels, where individual behaviors and knowledge drive utilization of these resources. And the biggest hurdle in addressing individual behaviors and knowledge are in higher level community and organizational issues around poverty, education, racism, and classism. For example, families and individuals struggling to pay bills and basic necessities often do not have the time or the money for healthy food or cooking at home. In fact, I know a lot of people who are doing really well both monetarily and career-wise who I could say the same about. Issues around physical activity often involve time and resources which are limited to low-income families. Even something as simple as walking around the neighborhood can be a challenge for, say, a single-parent household. So the main point I want to make is that in addition to the infrastructure piece, we also need the built environment to deal with how it contributes to poverty, educational attainment, racism, and classism. So let's step back for just a minute to think about what it is the built environment does for us other than the infrastructure piece. And so I want everybody to think about their favorite city that they've lived in, or if you've only lived in one area, why'd you stay there? Or why did you move to Colorado for that matter? Now I want everybody to just kind of keep those ideas in your head as we begin to move forward through this presentation, as we discuss sort of what the built environment provides for us. And that's the next question is, what does the built environment provide for people? Or another way to ask this is, why do we live in a society or a community? And I will argue there are two reasons. Number one is connectivity, and number two is interaction. These concepts are somewhat sequentially tied together, and as you see why, or you'll see why as I explain in the next slides. So let's first look at connection. This means the cities we live in are connecting people to groups and to communities. This connection can be based on the love of outdoor activities, which at one point was why many people moved to Colorado. It could be based on a profession or education. It could be based on connecting with established ethnic communities or neighborhoods or families. It could be a connection to the arts. It could be that someone wants a connection to diverse or different areas. There are a variety of things that drive us as people to connect to other people, and that is one of the primary functions cities can offer us. And once that connection is made, our cities provide the opportunity for interaction. This interaction can happen intentionally or unintentionally, meaning we can interact with people by going to different neighborhoods or schools, or we can interact through proximity, where we see people on the streets, we see people in parks, we see them surviving, doing what they need to do to get by. We are aware of one another. Interaction can be also through the exchange of ideas. This can happen through the arts, through news, through jobs, through social interaction, and finally interaction based on social mobility. The idea that living in a city that is connected and interactive can be inspiring that you are part of an environment that you feel can improve your own social standing. I could talk about these concepts for a long time, but hopefully you get the picture. But the next question is, how do concepts of connectivity and interaction play out in the built environment? Cities are often described as ecosystems similar to natural ecosystems. In describing connection and interactivity within a built environment ecosystem, it's important to understand as such with any ecosystem, these things do not operate in isolation. There are many factors that can affect this process, and as one process shifts, 5 others may follow. There are numerous ways this can occur, but for today I'm going to focus on 2, land development patterns and streets. So I'm going to use a few Denver metro neighborhoods for examples. I've actually lived in and completed projects in every one of these neighborhoods. And if you live in any of these neighborhoods, I don't want people to walk away thinking that I'm putting down where you live. There are a lot of good things and bad things about every neighborhood, and these characteristics occur everywhere in Colorado and across the country, so I'm not trying to single out any one place and saying this neighborhood is doing a bad job or that everyone needs to be like that neighborhood. So I'm merely just identifying built environment characteristics that could potentially shape our social determinants of health. Also, this is where we start to get into issues related to social science. So these relationships are fluid, and there are a lot of factors at play. And so the image we're looking at right now is an aerial of an intersection of a few neighborhoods in Denver, including City Park South, Park Hill, Congress Park, and Hale. These neighborhoods were built out around the 1920s. Now, what I want to describe first are a few ways land was developed around this time. For context, we're looking at City Park in the top left, Colfax Street running along the bottom, 17th Avenue, which is running across the middle, Montview, which is running across the top, and then Colorado Boulevard runs up and down the center of this image. The blue lines are the main arterial streets that move traffic. The areas in between are gridded off with smaller neighborhood streets and provide a predictable layout for easy access within the neighborhoods and to the arterial streets. This sort of layout does a few notable things. It provides a predictable development pattern for the land. It also connects any family living there to any other family living there and to a commercial district. The way land use occurs within these blocks also has a predictable hierarchy. Generally, the multifamily and bigger houses shown in the darkest orange sit on the corners and line the busier streets. These would be occupied by people renting apartments and wealthier families who can afford 5,000 square foot plus homes. And so within the interior of the blocks sit the smaller single-family homes. At the time, these were modest homes and duplexes that were around 1,000 square feet. The characteristic of sort of the bungalows that we see kind of all over urban Denver. And then finally, Colfax Avenue provides the commercial for the adjacent residential blocks. This would service the needs for what would potentially be a mix of incomes. So the effect of this layout is that historically you have a mix of housing types and mix of incomes. There are large, wealthy single-family homes down Montview and 17th, along with apartment units that mimic the size and style of those larger homes. And then the smaller, modest homes in the interior of the blocks. What this does for connection and interactivity is that the neighborhoods have equal access to one another through a street system that is understandable and continuous. No groups of housing are sectioned off from any other group. The physical arrangement of the buildings where larger ones line the larger streets and smaller ones line the smaller streets makes sense. The layout allows for both intentional and unintentional interaction of potentially different demographic groups through common open space, shared streets, and commercial uses. I also want to say that I'm by no means saying that we need to go back to this style of development from the 1920s to make us great again. If anything, these neighborhoods do not exhibit the diversity of incomes I just described. They're now primarily higher income families, most with single-family homes well above $500,000. The point I want to make is to reiterate this concept that there are physical characteristics of a neighborhood that can facilitate connection and interaction, and we can often find these characteristics in historic urban neighborhoods. So now let's take a look at one of our suburban areas. This is down in Highlands Ranch, and you can see that there's a pretty different approach going on here. So first, let's look at the street layout. The arterial streets, again, are shown in blue, traversing through the neighborhoods with the goal of getting cars to either the interstate or the commercial areas. Each neighborhood is limited to a few access points in and out of the neighborhood, indicated by the red dots. What happens with this type of layout is each neighborhood area is physically isolated through a street system that reduces access between neighborhoods and is generally pretty unpredictable. The streets are not designed as a destination or something of interest, but merely just to move individuals from their homes to a destination without much interaction. And the type of interaction we do have with people in their cars is generally not what we want. The one good thing about this area that you can see, so the open space sort of weaves between those neighborhood pods. So it does provide a level of interaction, but it's specific to the residents of Highlands Ranch. When we look at the development patterns in this area, you can see a few of the residential areas in white and orange, and they're very much segregated by home price. Much of this is driven by home builders who have a specific house product they want to sell, and developers design these pockets of homes around specific price points for that purpose. These pockets can often have a range of only $25,000 in home price. This means that families that live in these neighborhoods are likely to make about the same amount of money as their neighbors and share similar demographic characteristics as their neighbors. The implications of this and the street layout are that there's a greater chance that families and individuals are living in increasingly homogeneous areas with less exposure to anything that does not mirror themselves. The bubbles indicated in red are commercial areas that are often separated by from residential areas by large streets. And the way these commercial areas are designed reduces interaction because their access is almost exclusively by driving. Even going between stores adjacent to one another often means driving from one parking lot to another. Outside of the buildings, these are not places where you really feel safe as a pedestrian. These are significant issues around street design, parking, and site layout that apply to both suburban and urban Metro Denver that affect connection and interaction, but we'll have to save that for a later webinar. And then the last example I want to show you is looking at some issues related to connectivity and interaction that are occurring with our urban core, specific to gentrification. The area that's kind of highlighted in white is one of the fastest changing neighborhoods in Denver. This is the River North Arts District, or RiNo. It's formerly an industrial neighborhood with warehouses and manufacturing and lower income housing. But in a matter of a few years, RiNo has become one of the most expensive neighborhoods in Denver. The combination of proximity to downtown, what was inexpensive land, and sites that were easily developed has led to a significant change for the residents that have historically lived in that neighborhood. The influx of development has brought in hundreds of apartments and condos well above the Denver median price. And every day, lower income single-family homes are sold and replaced with $1 million-plus homes. The commercial services and amenities that have flooded the neighborhood are specifically geared toward young professionals with disposable income. I also don't want to imply that this is all bad. All of my neighbors who had been there for decades were excited that their land is now worth so much. They were also excited to live in a safer, more exciting neighborhood. However, they could not afford, and generally were not interested in any of the commercial development occurring. This development was geared toward a specific demographic which they were not a part of. And when all of this happens, existing residents start to feel more and more removed from their community. And as these people move out, a once established neighborhood begins to break up along with any social structures that help to support those residents. And so what I think captures it best, and this can be heard in all low-income neighborhoods and neighborhoods of color where upper middle-class people are moving, is when people continually say that the neighborhood is getting better. What does that mean, getting better? I think oftentimes people who have lived there have actually really enjoyed their neighborhood and the communities that they've established. So is it getting better because poor people are being forced to move out, or is it better because people of color are being forced to move out? I think whatever it is, comments such as this begin to reveal the underlying ideas and expectations that we have of different people and how we subconsciously think in terms of class. So there are 1,000 ways to interpret what is going on, but how I want to summarize everything we've gone over so far is that our land development patterns and streets can facilitate or hinder connection and interaction. And from what I've witnessed, we're moving in a way that is creating demographic silos through these built environment mechanisms. And I'll be the first to say that people generally do self-segregate, and our most interesting neighborhoods are those ethnic neighborhoods in all of our big cities that are homogeneous silos, the Little Italies and the Chinatowns. However, within the urban context, they are physically connected to each other and allow for that intentional and unintentional interaction. When we look at New York or Chicago, there's a feeling of overlap with other cultures and the idea and ideas, and all you have to do is walk down the street. You get on a transit system and you see people with all types of jobs and backgrounds. You understand that your experience of the world is only one, and that there are a million other ways people have to negotiate the world. And so what's lost when we lose connectivity and interaction? So number one is exposure to other communities and cultures. Number two is it reduces our ability to understand issues faced by a variety of incomes, races, cultures. We generally just only see ours at that point. Number three, the expectation we have of ourselves and our communities are reduced to what we are exposed to. When our children only see one outcome in the community for education, careers, and culture, that is what they understand as the expectation of themselves. And when television, movies, and media constantly portray a certain image of a group of people we have no personal experience with, that is the expectation we subconsciously apply to that group. We all know the results of living in a homogeneous silo with limited interaction with others. And with our opening example, that this is why we see that poverty tends to breed poverty, why our careers are often similar in topic and social status as our parents. Children have a way of generally living up to the expectations of our families and the expectations of the community around us. We need that connection to show kids and adults there are a variety of outcomes for life, that we're not entitled to live a certain lifestyle, or that you can see opportunities outside of poverty, that the expectations we as individuals and as a society place on our children or our community are not based on how we're economically segregated by our built environment. We need to promote a built environment where we interact with a variety of people achieving at a variety of levels. If we truly want to address social determinants of health through the built environment, it needs to facilitate connection and interaction with all its residents, where cities can be seen more as an ecosystem that understands and values all its parts, where the basis for our expectations of people are based on real-life experiences and interactions. And so finally, the last part I want to discuss is what's public health's role in addressing the social determinants of health through the built environment by, number one, looking at the planning process to see where we can interject, and number two, review real-life local examples that can provide some additional context for these ideas. I think what I've talked about so far has been very broad and somewhat vague, but I think if we look at things that are going on in our community, it'll provide a little bit more understanding. So I'm not sure how many of you are familiar with the planning process, but I want to do a really brief summary on how the system generally works before we discuss the examples. I don't want to oversimplify this either because we could probably dedicate an entire webinar series on this one slide, and the process can be slightly different depending on the municipality. So let's start out on the basis for decision side. So on the right-hand side, that just lists out all of the components that feed into why the decision makers make a decision about the built environment. Cities and counties have what are called comprehensive master plans. They lay out a vision for growth and development in a community and get updated on some cycle, but it could be every 3 years or 5 years or 10 years. Any change in land use gets reviewed against the comp plan to see if it aligns and is in keeping with the spirit of what was being laid out in the comp plan. There are also zoning codes that lay out specifically what you can and cannot build within every land use designation found in a city or county. So specifics about land use and physical form of a project are reviewed against a zoning or development code to determine if it's in compliance. So if we move to the other side, generally what happens is an applicant has a project and brings it to the planning staff. This project is either to rezone a piece of land or build something that is an allowed use under the current zoning. So staff will look at the project and review it against either the comp plan or the zoning guidelines and make recommendations to a planning commission who are appointed, and their decision about the project is based entirely on whether or not it complies with the comp plan or zoning code. At a public hearing, the Planning Commission will review the project taking into account the staff's recommendations, and they will make recommendations to the City Council or Board of County Commissioners for approval or denial. But they can also add conditions for approval based on public comments that come in at either through email or at the public hearing. At another public hearing, the City Council or Board of County Commissioners will review the project taking into account Planning Commission's recommendations and public input and approve or deny the project. They can also add conditions for approval based on public comments as well. So between all of these stages, the applicant has the opportunity to adjust their project based on input from the city, public, the consultants, attorneys, and investors. This process gets repeated over and over again based on which stage of the project is currently in review. It could be rezoning, it could be a site plan, the development plan, a final plat. So approval is based on criteria for that specific stage. This can be a complicated process where I tend to see public health's primary role is in attempting to shape the guiding principles found within the comprehensive master plan. I also see some role in helping to shape some of the zoning regulations, but let's quickly look at two examples where this takes place. And I want to emphasize these are two examples that have come to my, or the two examples that have come to my attention are fairly new, and that there really are not any solutions in place for these. And I bring them up as a way of thinking about the complexity of the situations in which these take place. So the first one, this site is called Denver Meadows. It's a mobile home park right next to Anschutz Medical Campus and the new VA and a new light rail stop. There are around 180 families that have been living there, and some of them for quite some time. The owner wants to rezone the land to transit-oriented development and then probably sell it to a builder, which means most likely it will be a few hundred condos or apartments with some commercial. In the comp plan, this area is also designated for transit-oriented development. But let's think of this in terms of what we just talked about. The area has the potential to be an active hub of many different uses. We have an area that is rapidly developing because of a university, multiple hospitals, and open space. We have the convergence of major streets, an interstate, and a mass transit stop. The area is surrounded by single-family, middle-class homes of all ethnic backgrounds, both high and low income apartments and condos, and quite a few mobile home parks. So how do we keep and maintain a diverse community in this area? Or is that even important for this area? Should we be replacing the lower income housing with $2,000 apartments or $250,000 condos? And if so, what does it mean when we are willing to displace the most vulnerable residents who have lived there for years? Should those low income families also not have access to mass transit and open space? Should they not also be exposed to and have awareness of a university and life beyond poverty? The landowner also has a right to do what he wants with his land, and at the same time, the city has a right to shape the way that they want to grow. So how do we convince people that stable housing is a public health issue and that having a connected and interactive community can potentially help address social determinants of health? So these are all questions that should be addressed when we talk about the built environment. So back to the first question, which was, what is the role of public health? If we had been part of the creation of the last comprehensive master plan, we could have identified these conflicts as as a public health issue and made the case that having communities that are connected and can interact with diverse populations is part of a strategy that attempts to address social determinants of health. We could have also argued that all people, regardless of how much money they make, should have equal right to access mass transit, and so transit-oriented development should also include all types of income levels of housing. Now this problem is difficult because in the current comp plan, the area is designated for transit-oriented development. If rezoning is approved for transit-oriented development, the land becomes incredibly valuable and can be sold to investors who can build it out. However, if the city denies the zoning application, the owner could still sell the land or kick everyone off and build something within the current zoning. Both these scenarios break up an established community, placing them under severe financial hardship, and most likely makes things worse for them regarding their social determinants of health. The residents also have the option to get together and try and buy the land from the owner as a collective group, which is the option they're currently working on. This is definitely a contentious issue for all parties involved. However, understanding the process and knowing what we as public health or as citizens can influence can give us a stronger role in what is taking shape in our communities. The second example is a little more straightforward, and it is one I'm including because I've heard it brought up quite a few times in the last few months. This relates to liquor store density and substance abuse. There have been conversations discussing ideas that certain neighborhoods have higher densities of liquor stores. In reviewing the data here at Tri-County and based on the entire state, it doesn't necessarily seem to be the case. For those who are interested, I've included a link to the web map where we have all of this data down at the bottom of the screen. So once you adjust for population density in commercial districts, we find that the liquor store density is fairly evenly distributed. But I'll argue there's something else going on here. Sedona Allen, a youth advisor at Denver Public Health, I think really helped bring this to light with some of the work she's done in her neighborhood, and that is that liquor stores present themselves differently in different communities. In poorer communities, the building itself seems to be a billboard for liquor and cigarettes and beer. In wealthier areas, the advertisements are much more subdued, and in this example, one of them has what looks like, I think it's agricultural fields painted on the side, while the one on the right-hand side, it's hiding behind that tree, but you can barely see it compared to what's around it. So given an equal distribution of stores, this outward appearance could make it seem as if there are more liquor stores in poor communities compared to wealthier ones. In addition to the fact that plastering advertisements for alcohol and cigarettes on a building in any neighborhood is probably not something any of us want for numerous reasons. And if we want to take a built environment strategy in addressing what is occurring, we could easily work with our planning departments to change signage regulations as it relates to liquor stores. This is kind of in the same way that marijuana facilities are regulated around their physical appearance. So could liquor stores. These guidelines or lack of guidelines can be found in zoning regulations in reference to liquor stores, as well as any applicable signage regulations. And so what I think this all means for public health is that we really need to step out of our comfort zones of the work we've been doing. We talk a lot about collaborating with other disciplines. And so I think that we just need to do it, and we need to do it with something meaningful. In regards to the built environment, planners are actually really eager to give their work some additional meaning by addressing health, but most of the time they're not exactly sure how to make that happen besides the infrastructure piece. So I think public health needs to start understanding some of these built environment processes and start providing some guidance on where we can make meaningful improvements by addressing social determinants of health. And so with that, I'm happy to take any questions.
Excellent. Thank you so much, Adam. That was wonderful. We do have a couple of questions entered, and just as a reminder to everybody, feel free to go ahead and click on either the questions tab or the chat tab on your kind of control panel and type in your question, and we'll make sure that it gets addressed. Also, a reminder that today's presentation and all of the Colorado Public Health webinar series presentations are archived on the CPHA website, where CPHA members can go in and access all of those, as well as some of the additional resources and links relevant to the topics. One of the links that Adam shared on the liquor store slide, I think we're having some trouble following that link, so we're going to double check the URL for that, and we'll make sure to get that out. One of the questions that came up was, as we were kind of looking through, in particular, the map of Highlands Ranch and thinking about suburban areas with poor access streets, those streets are already laid out. And so to what extent or what solutions and possible approaches are there to kind of address some of the challenges when the layout seems fairly permanent? And kind of building on that, is increasing facilities effective? Is it actually possible to go back and retroactively change the street design? What are some solutions that you've seen?
So I think that the one good thing about the built environment is it's not a static piece. So it's always changing. And I mean, it may seem like it's changing at a geologic time scale sometimes, because sometimes it's out of our what seems like our lifetime. But I think that just going in and having a voice in the comprehensive master plan, so whether that's Douglas County or Highlands Ranch, and saying that from this point forward, we need to, with any redevelopment or new development, we need to be keeping those ideas that we need a connected community and a diverse community both. And we can do diversity, meaning in this case probably income. But those are considerations that need to be accounted for in every decision as it relates to rezoning or a site plan approval. And then there are other smaller things I think that could happen where, and I'm not exactly you might have to address the Highlands Ranch HOA, but in terms of not segregating or isolating their open space to just residents of Highlands Ranch. I think you actually have to have a permit to use their open space, and what that would mean if you open that up to all people. I know there are a lot of other, in Douglas County, the people that live in sort of more of the rural areas probably could use that space as well, and they would not have a Highlands Ranch permit to use that space as it currently stands.
Thank you. When thinking about the example out at Anschutz campus in Denver Meadows, could redevelopment in the plan for the area include new development of affordable housing, perhaps built first, to provide those existing residents with healthier housing and better connections to a diverse community, and not disconnect them from their current neighbors?
Yeah, I totally think that's a relevant option. It seems, I don't know all of the details, but I know that Denver has somewhat successfully done that in terms of its Mariposa development, where the people that were living in subsidized and income-restricted housing were actually provided housing in the new buildings before that their old buildings were torn down. So that is an option, but I think that given that those people have been there for quite some time, to some degree, and they have an established community, that their voice should be as equally as relevant as people who are arguing for putting in condos with a certain percentage of affordable housing, which in most cases they probably wouldn't be able to afford anyways. So I think that it is an option, and it's a fairly complex situation where if you could put all of those people into a say a condo building that they could all afford, maybe that is a solution. So
okay. Does Tri-County or any other resource that you know of offer additional web maps looking at the built environment characteristics? Specifically curious about the character, this came up in the context of the liquor store map, but so wondering, are there any additional maps for that issue? And then are there other resources that you're aware of where the general public health community could go to learn more and benefit from some of the work that the epidemiologist community does with mapping?
So I want to say there are a lot of web maps that are sort of scattered around that a lot of different agencies have put together. Tri-County has several web maps. I'm trying to think, not necessarily specific to that sort of substance abuse liquor category. We actually will be putting together several substance abuse related maps coming up. We're trying to sort of, because each web map has its own website, it becomes hard to sort of wrangle them all in. So we're actually working on creating sort of a central repository of all of our web maps. So that'll be coming in the future, where we'll just sort of archive everything that we've done. CDPHE has put together several really great web maps as well. But again, they all have their own URLs and kind of are floating all over the place. And there's not really one spot where you can access all of them without knowing what the specific topic area is and actually Googling it and hoping that it hits the right search terms. But as far as other web maps that can help out with similar topics, I know that the State Demographer's Office within the Department of Local Affairs has some very good web maps just regarding population level data and community characteristics that can be found on their website.
So Adam, you mentioned that residents can really contribute to the shaping of their own communities, whether it's how streets are developed, how spaces are distributed. Wondering if it feels like the ability to actively and meaningfully participate is in any way impacted by class and race. So is it harder for poor residents to have access to those opportunities to participate as compared to maybe residents in Highlands Ranch shaping some of their so you see that being stratified at all by income or race or any other demographic indicator?
I think that it does in turn on a couple issues. So one is in terms of just understanding the process. I think that people who have an education are probably more likely to be able to understand the whole process. But even then, I think the planning process is really difficult for just about anybody to understand. But generally, the public hearings, they try and hold those in the evenings, which whether or not that relates to the type of job you have, I guess in a lot of cases it does, and whether or not you're able to attend those, whether or not you're able to get childcare to go to a public hearing. But I think that as far as participating in that public hearing, I would say that from what I've seen, everybody is equally represented there. Everybody has a chance to go up and stand and talk to their county commissioners or city council for the 2 minutes or whatever their allotted time is. And I think that county commissioners and city council are very cognizant of the fact that they are elected officials, so they do make decisions based on public input. So I would say that the limitation to participation in that arena is based on your ability to gather large groups of people to support or deny or support or oppose whatever happens to be being decided on at the time. And so maybe people of means are more likely to be able to rally something like that together. But if you had 100 well-off people and 100 middle-class people and 100 poor people all up there I think that they would have an equal voice given the opportunity or being able to be there. Okay, if that makes sense.
Yeah. Let's see. One last question, and then I want to mention a couple of the additional comments that we've received. So let's see. In your experience, what do you think some of the best strategies are for really connecting residential and commercial corridors? What are kind of maybe the leading edge of best practices there? Some examples for how some communities are doing it really well.
I think one of the major things we can do is provide multiple options from getting from residential to commercial areas, and making that making the priority that the priority is the multiple options, and that it's not just about driving from point A to point B, that that the car is not the center of focus. So being able to safely walk from one point to another, being able to safely ride your bike from one point or another, having bus access or rail access. So I think that issue of connection to just the physical connection is one of the biggest things we can do, and then making that physical connection not just dominated by what the experience of an automobile is to get there, but what the experience of sort of multiple means of getting there are.
Mm-hmm. Cool. So unsurprisingly, we have a lot of experts on this topic participating today out in the audience. And so in addition to some really great questions, we also received some just really helpful additional comments from some folks out there. So, you know, there's a huge amount of complexity to these issues, as Adam has alluded to several times. When we think about the Denver Meadows situation, you know, there's a big challenge for folks who are living in mobile homes, and they don't own the land they live on, they own the home that they're in. And so it makes it very challenging when you're thinking about the rights of the landowner versus the considerations that need to be given to the mobile home owner. And going hand in hand in that, and even larger, more broadly in this conversation, I think it's really incumbent on all of us to figure out how we quantify, how we put a value on diversity and neighborhood preservation. That's kind of like this assumed importance that we hope everybody would share, but when you're actually going up against folks whose interest may be the bottom line of their effort, it can be a very difficult thing to relate and make it a challenging competition. And as you're trying to have your voice heard, one of the other really important comments to point out is while there is that opportunity to get up in front and have your voice heard, we do want to acknowledge that you know, when we think about some of the pressure being put on the immigrant population in particular, there might be reluctance to participate in some of those things. So we've got multiple social justice and public health issues popping up, all in the context of this built environment conversation. A couple of additional resources that were also shared, and we'll make sure that we get these posted along with the webinar, are the Regional Equity Atlas developed by the Piton Foundation, DRCOG, and Mile High Connects. Say that one more time.
Dr. Cog.
Dr. Cog shows what an epidemiologist I am. And Mile High Connects. So we'll post some of those resources along with the archived webinar on the Public Health Association website. That leads us just up to the end of our time. I want to thank all of you so much for participating. We welcome additional questions. Feel free to reach out to myself, Brian Turner, or Adam Anderson, or anybody at the Public Health Association with additional questions, comments, feedback. We look forward to having everybody join for our future webinars. We'll be getting information about those out to all of you. And keep in mind the June 23rd Culture of Data Conference, our Public Health in the Rockies Conference this October in Keystone, and check out the CPHA website for a lot of other opportunities for you to get connected with the public health community in our state. Thank you very much for joining. Have a wonderful afternoon.